Michael, you and I have been researching the cosmetic surgery industry in Australia and also a global part of that as well for nearly 3 years now.
Has it
And
been that long?
yes, it certainly feels like longer. But my thoughts are there have been these new rules that have come in the past month, and now it's starting to hit the news this week. And we've heard some celebrity identity voices starting to decide that it's actually not good for the public. What do you think when we've put in so much research into this industry and seen the incredible harm it's done? How do you feel, and what do you think when these celebrity identities and voices decide that they know better?
Yeah, I think that a lot of the time when they speak, they maybe don't get given all the information. So it happens through the rumor mill. Someone heard something that told them, and naturally, even I find myself believing some of the headlines, and I have to go back and check. We go and look and see, no, it actually doesn't say that. And I think that's been happening in the news in the last, 24 hours, is there's been certain things that actually aren't the case that have been getting shopped around, and you were talking about it earlier.
And what was that? I know that it was to do with getting a psychology appointment, but what was the sort of misinformation that was being shared?
I suppose that everybody is going to need to get a psychologist appointment before they can get cosmetic surgery, and maybe even if they're getting Botox, they need to go to a shrink. But the reality is, our understanding, looking at it, is that it's only if your surgeon has an obligation to do this test to check your suitability and make sure that there's no underlying issues that may require an expert opinion that is not theirs in the realm of psychology.
Yeah, and I really have not enjoyed the narrative that it's going to just really impact our healthcare system, which is already buckling under pressure. I actually feel like the number one goal here needs to be patient safety. That's the whole point of these guidelines, these new rules, is to protect the public from unscrupulous cosmetic surgeons at the end of the day. And I feel like these new rules aim to do that. And I think that if we ensure that people who actually need this help, this mental health help, are being required by their surgeon to go and get it, that is in the patient's best interest, but it can also end up help saving the public health system, because it stops somebody who does undergo surgery who shouldn't have from being a burden on that system, or from requiring further interventions in the public health system because it's actually harmed their mental health further.
Well, we've had people, as we've done the rounds, come up and speak to us or give us a call or whatever, that have actually been and had surgery that they didn't want to have, or the surgeon talked them into a procedure, or botched a procedure that they wanted, and they're now doing endless visits to the GP and going back to the hospital, and it goes for years, and it's not one or two, it's many. And look at one of the doctors that was exposed with the original scandal where we were in that story. There's now nearly 900 people in a class action against that doctor. And imagine all those people, if they're claiming to have been injured, alleging to have been injured by any of those doctors, what kind of care must they have needed to this point? Going to GPs, going to psychologists, going to psychiatrists, going to all kinds of specialists because they allege they've been harmed.
And I do think that voice has been missing from this conversation, the burden of cosmetic surgery on the public health system and the health system in general. We're talking now about the preventative measures being made law, essentially, to help protect patients, and the burden that's having on the healthcare system. But what we're not talking about is the existing burden that cosmetic surgery has on the healthcare system.
Yeah, and I think, we've got plenty to say about regulators and what they do and don't do. And they had for a long time been inactive in this space. But I think that they've looked at the problem and tried to find a sensible solution. And when you actually hear, so the plastic surgery industry is generally not happy with some of the recommendations and things that have come out of the changes. But one thing that they seem to agree with is that they already send their patients to get a GP consult and assess their patients to ensure that they are acting in the interest and there's nothing in the pathology that needs to be picked up. So they're already doing that. So the plastic surgery community is not necessarily opposed to those components because they've already been doing it. And I think the reason we're talking about this is for all the people out there that aren't doing the checks and balances, which sometimes may be plastic surgeons as well.
And I think most GPs kind of want to know what their patients are up to, and if they are going to take such a huge step and alter their body, their physical appearance through something so risky and dangerous like cosmetic surgery, they want to know. I'd like to think that anyway. I'd like to think that general practitioners care about their patients and genuinely want to know what's going on in their lives. And I don't think that they would have an issue with sending referrals to doctors who hopefully have the specialist skills to do surgery.
Yeah, it's kind of like a dial before you dig. You know that motto, dial before you dig? It's a bit like that, isn't it? It's sort of saying, like, if you're a surgeon, you're going to be cutting around in there, just make sure that there's nothing. And we hear of like doctors that have not checked the medical history of the patient who's had like an abdominal mesh. So they've started doing a tummy tuck and then they've found themselves cutting into a mesh and having to abort the surgery halfway through. So that's the importance of these checks and balances. I'm not saying it's a perfect system, but it is something, isn't it? It is something to go like to ensure that you actually check that your patient is well enough in many ways. And it's not judging the patient for wanting a surgery. And as we always say and have from the beginning, your body, your choice. Don't care how much surgery you want to get done. You just deserve to have it with dignity and respect. And the doctor needs to put you first and your needs first and make sure you're fully informed of the risks and not just use you as a marketing tool to get the next one.
Exactly. And I think it's really irresponsible for influencers to say that once you turn 18, that's it. You should just be allowed to do what you want. Because doctors at the end of the day have done all the training and have that education and the qualifications to be able to determine whether you are suitable mentally and physically to undergo surgery. So I think it's too simplistic to say, well, you're 18, you can make your own choices. I think that there are many reasons why people can't or are unable to make those choices for themselves, especially if they are struggling with something like body dysmorphia. And that is something that hopefully these new guidelines will help tackle.
Yeah. And you hear that, I suppose, again, we hear in conversation that people that were turned away by a responsible doctor or surgeon have gone to someone that was happy to do the surgery regardless. And often when that doesn't work out, that person, the patient, has to go back to a responsible surgeon. And that really disheartens those often plastic surgeons who feel helpless because that person got maimed and they didn't want that to happen. That's why they didn't operate. And now they've got to try and help this person recover. And it's very expensive to do the procedures to sort of attempt to make things right.
Yeah. At the end of the day, I think that largely requiring people to undergo a valid psychological assessment tool by the surgeon who's doing the surgery is good. And I think requiring those who don't pass that to get a psychologist appointment, I think that's only a good thing. These are people who need it. And I don't think that it's in any way hurting the healthcare system because these people need this healthcare. So to say that that's going to harm the healthcare system, I think it's actually really irresponsible.
Yeah. Well, and we see, by the way, we've seen doctors, even ones that maybe leave a lot to be desired when they actually see these patients. Sometimes they actually pick up things that aren't related to the surgery and send that person off to say, listen, you might have a tumor here, go and get a scan done. So being responsible can actually help people in ways that the patient didn't even anticipate. You might have a lump here that needs to get checked out. It could be bad, it might be nothing. Go and have a look. So I think it's really important that those checks happen. And like you were saying at the beginning of this, there's just so much of a burden already that's happening because there's been too many surgeries happening to people who aren't ready or actually didn't want that procedure or found themselves signing up with one doctor and getting another doctor and getting botched, and causing a whole range of complications, including massive burden to the hospital system, going into ICU, all that. And apparently that happens quite often in our public hospitals at a tremendous cost to the public.
Yeah, I do not see the harm in making people wait who do need to go to a psychologist a few extra months. I just don't see the harm in that. I think that could end up, they could end up changing their mind on their own at the end of the day. And that just goes to show the trend-based nature of these surgeries in the first place, that this is something that's permanent and people are doing something based on trends and what they're seeing online. So I think that if some patients are forced to wait a few extra months, it could actually be beneficial. If they still want it, they can still get it, as long as they get the appropriate approvals.
Yeah, I know. It's and I think that's sort of led us down the road that we're going on now that we've started talking about, right?
Yeah. We are obviously introducing a podcast that we hope to release in the coming weeks or months. We'll start anyway. We hope to start that. And yeah, hopefully it'll reveal the dark side of cosmetic surgery. I know that a lot of doctors will be a little bit worried by it, but at the end of the day, we're just trying to help expose the truth of what goes on. On social media, you're largely seeing a very curated version of only good results, amazing outcomes, things that are often not even real. They're photoshopped or filtered, and people look at these images and think that that's what they want. They want to look like that, and they think that it's achievable when it's actually an unrealistic beauty standard. And I hope that from the podcast that we do, that we can just ignore all that and just delve right down into the facts about what is happening. Forget all the PR, forget all the spin, just literally what is happening in this industry that is really taking over the whole world.
We essentially landed on, it's the dark side. It's what they don't want you to see, isn't it? It's what the industry... I've had professionals that are in the sector on numerous occasions say to me, oh, we don't want to put all the risks in the advertising because the patients won't get surgeries. And these are people that I would normally consider more responsible and ethical. And even then, so we've had this creeping lowering of standards that even really decent people who care about patients still have this little voice in their head that says, better not say anything about the risk too much until we get them in the door. And I even heard this plastic surgeon on a podcast recently saying, and not an Australian one, saying that he doesn't like the P word. He doesn't say pain to patients. That's a no-no. He says discomfort.
It's really disturbing because we know that patients can actually have permanent nerve pain, permanent nerve damage that they didn't fully understand could actually happen to them because they wanted, a cosmetic surgery that was advertised to them as being quick and easy. And you might be out of work for a couple of weeks, but you'll be fine. We're really good here. I think that doing anything that minimizes the pain, the discomfort, the risks is completely irresponsible of doctors, but it is everywhere online, everywhere on social media, and it's happening not just here, it's happening all around the world. The US is a big offender in this as well.
I think that we, in the beginning, remember that when we started this, especially you didn't want to do it. I didn't want to do it, but I was kind of egging you on a bit that we should do it because it seemed important and we already had so many other things to do. And then one thing we said is we'll never do a podcast. No, we're not going to do a podcast. So here we are a few years later, finding that we've done a lot of work in this space, and now we're doing a podcast, despite the fact that we cringed when we wanted about doing, we just didn't want to do it. But we realized that this is a global issue, and I suppose our goal out of this podcast is to work towards actually getting a global discussion going about how we can change this industry. And it really, we believe, don't we, that it starts with the advertising. And I think countries around the world are starting to see and crack down on some of the advertising, even in places like China.
Yeah, it's really interesting to see that there's this boom that's just happened everywhere, seemingly at the same time. And the other work that we've done, it's sort of been in business, in franchising and wage theft, transport. But this was something that's sort of happening everywhere around the world. And because we've been successful in creating change on a legislative and regulatory level, or at least contributing to getting that change happen, we felt that given that this is a worldwide issue, we really need to try and create worldwide change. And I think that given that governments and regulators around the world are already alert to what's happening here, I think that there is actual genuine possibility that we can do that collectively as a society and as communities that are concerned about what we're seeing online and the effect that cosmetic surgery advertising is having on everybody, not just vulnerable people. I guess I like to say we're all vulnerable because we all have insecurities, and doctors love to target those insecurities online. You know, a little bit of fat under your chin, your ears stick out a little bit too much, or even at all. You know, it's just that will get targeted. And once you start looking at these videos, they then creep into the algorithm and you start to genuinely think that there is something wrong with you. So I think that cracking down on this kind of advertising would be a great start for governments to start doing.
Yeah, and I think, so if we, with season 1, if we start in Australia, make it about Australia, talking only to people in the Australian landscape of plastic and cosmetic aesthetic surgery, and then we take season 2 to another country, and it's going to be a little bit different, this one, because we're actually going to film the podcast and also do it in different locations. So we're not going to be stationary with it. And we've already been overseas on something that we can't talk about yet, but there's more to come in this space. And we're going to try and film some of the journey and really try and get some actual change going. And I think our discussions with others around the world so far have been very receptive about the possibility of change. And
I think that's what we do at our core. That's who we are. There's no point in just causing outrage or, you know, for what? What's the point in that? What's the point in making people angry if you're not going to follow through with something that will create change? And that's just who we are at our core. And that's what we've tried to do with everything that we've started, at great personal expense and risk. But I think that that's sort of where we're trying to go with this. But now it's not just Australia, it's going to try and be the whole world, but starting here. Yeah,
I'm really excited because we don't know what country 2 looks like yet, but we have been doing lots of research, haven't we, about the laws around the world and what different countries are doing. And we know Australia pretty good, and Australia knows us pretty good in this space in terms of the people in the industry. And I think it'll be educational. This podcast, doctors always say that their advertising is educational by telling you the CCs of a breast implant. I hope this is actually educational to people wanting to get surgery, people looking to legislate, people in the sector that want to improve their standards. So the things that we're talking about, we've been listening to a lot of the conversations and industry podcasts and industry discussions. And normally the best you ever get when they're talking about the risks and the seriousness of surgery is normally followed by, so they'll say it's really dangerous and this can happen and that can happen. That's why you need to be using someone like us who's really safe. So it's kind of like saying, you know, you could die in a plane, but you won't ever die in my plane. But you can argue, I told all the passengers that it was risky, but you kind of then told them it's not, because you're safe. And no plastic surgeon or cosmetic doctor would actually believe that every single surgery is guaranteed to be safe. Otherwise, you would be able to say it. It would be based in science or surveys of every single patient you've ever had. No one's ever been harmed. No one's ever had a complication.
Yeah, and I think that one thing that we really want to do is see the risks actually explicitly listed in their advertising, because they exist, the risks are there, and minimizing them and underrepresenting them, all that does is cause the harm that we see so frequently. And really terrible stories have come out in the media that really showcases that harm and how predominantly women have had to endure the pain that they've experienced at the hands of these doctors. And they largely rope them in through advertising.
Yeah, it's sort of it's funny when you're actually talking to people from the sector who want to improve it. It's the industry's so far gone that their version of improving it is still abhorrent to us. But they're actually trying, so we want to help them, right? We want to help them see better, but we have to keep saying, like, you're actually like a medical professional. This is surgery. It's risky. It's not meant to be fun and exciting. You might enjoy it, but it's not your job to make the patient feel like it's going to be lots of fun. And when you actually speak to those patients, they go, it bloody hurt. I bled everywhere. I bled all over the hotel room. Some people develop dependencies on drugs. There's all kinds of things that can happen, however rare, as a result of surgery.
We don't even know how rare they are because as far as we know, the statistics aren't really kept. Doctors don't necessarily report their complications to the relevant regulators. Often patients are encouraged to sign NDAs, non-disclosure agreements, and they believe that they don't have the right to go to a regulator, or they get what they want and they don't want to take the complaint further. And what that means is it's actually burying the issues and the themes that emerge. And that's how you get doctors who run for 20 years with all these issues and nobody knows about it.
Yeah, and because doctors can be an offended bunch, we just want to say we're not talking about anyone specific. We're talking about the industry. We're not even talking about Australia. We're talking about global. We're talking in general about the global issues, right?
Yeah, we do not want to be naming doctors here. This is not what this is about. This is not about singling out anybody in particular. This is about trying to start or continue a conversation about the industry that is causing harm to people.
I think the media play a very important role in investigating businesses and exposing certain practices. I think that's not what we're trying to do here. We're trying to carry on a discussion about how it can change for everyone. So not just patients benefit, but regulators benefit, the doctors that are doing surgery benefit, that it's largely like a win for all. And the reality will be that I would imagine people in the sector may earn less, which they're already earning a lot anyway, but they may earn less because they're not doing as many surgeries. But it's a conversation that needs to be had, and it needs to be had on a global level. And I think if we can sort of bring everyone together to have that discussion, it would be amazing.
Yeah, so I hope that we're maybe not welcomed, but I hope that doctors can respect and understand our position and where we're coming from and why this is so important going forward.
I'm really happy that like a lot of plastics have reached out to us, and they even say, some of them say, I don't like this and I don't like that, and I'm not very happy about this. But generally, many of the things are good. Even if I'm not excited about it, they're actually good for the industry, and therefore that really shows, I suppose, the true intention of what they're trying to do. They actually care about the patient as well, but the industry's crept so low with the standard that I think everyone's just got to lift together. But so we're going to have, like, if people want to follow us, we're trying to have the same sort of social media handle, which is opred.social for Instagram and opred.social for YouTube, opred.social.
They're both very new accounts, even though we've been doing some form of consumer advocacy for many, many years. We haven't really focused on our own brand. So this is new for us as well. You won't find a lot on there at the moment, but that's something that we're building upon. And we'd love for people to join us at the very start of this journey that we go on. And yeah, hopefully you'll see us improve as well as we go.
Maybe you can be our 10th follower.
I think it's 23rd follower. But yeah, I mean, it hasn't been our focus, but now I think we're really trying to drive change in this. So yeah, as many followers as we can get and people who are actively contributing, I think that could only be a good thing.
And our email for the podcast we've just set up, which is called what?
podcast@opred.com.au.
Yeah, that's right. Dark Side Podcast.
Yeah. And so, feel free to write in. I mean, obviously very early days still with a lot of this stuff, but I think we've got a good outline in terms of what we want to do going forward with the podcast. We've reached out to a few people already, and hopefully we can start dropping some episodes pretty soon.